quite exciting updates of this guidance, and really what we're looking at with respect to the general public in areas where there is widespread community transmission and containment measures or control measures such as testing, contact tracing, or maintaining physical distance is a challenge for the general public. There is now the advice that they can use or should be encouraged the use of non-medical mask. The non-medical mask is often called face coverings or cloth mask, and here we're using the terminology from now onwards as fabric mask. So these are basically things that either can be made at home, they can be commercially purchased. We actually have some here we can show. The idea is that these actually, the reason we're doing this is because many times in the community now there are concerns about not only not maintaining the distance, but there is discussions now around how much transmission is happening through either pre-symptomatic or asymptomatic transmission. So taking that into consideration, and as Benedetta was saying before, this was then taken back also to the guideline development group and looked at. And now really the consensus coming out is that when people are in the public with these masks, they can actually use, and they provide some source of actually control. So what they do is they prevent person who may actually have the disease from transmitting it to somebody else.
So if I might just add to that, yes, so we do have this new advice to encourage decision makers to make the recommendation to wear a face covering and a fabric mask. And what is really new in the guidance that is being published is the research that we requested to be done on this innovation and engineering and looking at actually which types of materials can be used in making these non-medical or fabric masks. So what we have in the guidance are details around which types of materials, the numbers of the layers, and we recommend 3 layers of, to build this fabric. The inner layer being an absorbent material like cotton, a middle layer of non-woven materials such as polypropylene, which is the filter, and an outer layer which is of a non-absorbent material such as a polyester or a polyester blend. And in doing so, what the evidence we have through this research is that with those 3 layers and in that combination, that fabric can actually provide a mechanistic barrier that if someone were infected with COVID-19, it could prevent those droplets from going through and infecting someone else. And this is new, novel research that WHO commissioned that we didn't have a month ago. And this started when we convened the world's experts on a variety of topics in February to discuss what are the key questions, what are the critical questions that must be answered in areas all the way from epidemiology to infection prevention and control, health workers, all the way through clinical trials for vaccines and therapeutics. And this is new, and this should be encouraged even more. We need our partners to carry out studies to be able to help us make the best guidance going forward. So if people are going to wear a medical mask, a non-medical mask, or a fabric mask, it can be done using materials that can actually provide that barrier. And in our guidance that we're releasing now, it gives the outlines to do so. And we're talking not about giving advice to companies to build them. You can do this at home. These are materials that can be sourced by individuals and put together in a certain way so that it can provide that barrier. So that is something that is new. This area of research will expand, it will grow, and we will evolve our guidance as more information becomes available. We also encourage leaders and countries that have the capacity to do so, to carry out studies to show how do these masks work, what kind of benefit do they provide, because we need this. We need to fill this space. It's an open question, and we need the research to be conducted, and we need your help in doing that.
And maybe I could just also help to clarify that WHO has been saying for months now that we would support countries implementing broader mask use as part of a comprehensive strategy to contain this disease. And again, we've emphasised previously, and would like to emphasise again today, that the primary use of masks at community level are as a process of source control. In other words, they're mainly aimed at preventing one person giving the disease to somebody else. They're managing the person as a source. And in that sense, wearing a mask in a community level is more about protecting others if you happen to be infected rather than protecting yourself. So it's an altruistic act in that sense. And it is to be done where you cannot keep an appropriate distance from others. So if I'm trying to protect others from any potential that I would infect them, the first thing I will do is stay away physically from them. But there are situations like public transport where that cannot be maintained. And in that situation, the wearing of a mask will assist in reducing the risk of you becoming a source of disease for others. But let me also emphasise that if you are sick with a fever, with a cough and are sneezing, you should not be in public. You should be seeking the care of a medical professional and seeking a COVID-19 test. And if that test is positive, you need to be cared for appropriately in isolation, and all of your contacts need to be traced and followed for 14 days. And this is where the Director General has said in his speech that masks are part of a comprehensive solution. And we to be very, very, very careful that masks are not seen as an alternative to the other public health measures that are so desperately needed. And you'll see in the countries that have done well, and many people have said to me, well, masks are used broadly in country X or country Y, and country X and country Y are doing well. That's great. But in those countries, case finding, cluster investigation, widespread testing, isolation of cases, and quarantining of contacts is also done comprehensively. So where we see success in countries, and I think I said it at the last presser, is a well-educated, empowered community, caring for their own personal hygiene and protection, caring for the rest of their community in terms of protection, and being supported by a public health service that's capable of finding the virus, isolating cases, quarantining contacts, a health system that's capable of treating people successfully, and all of that in the context of good coordination, good governance. When that is being implemented, then the appropriate and targeted use of masks at community level in order to reduce transmission within the community in areas where physical distance cannot be maintained. And I think we've been consistent in this, and I think the work over the last number of weeks, and we'd like to thank our academic and science partners for this, was to come up with what is the best form of face covering, how can we make those face coverings most effective in achieving that objective. Thank you.
Thank you very much. Now we will go to the United Arab Emirates News Agency. We have with us Ahmed Haroun. Ahmed? Can you just press unmute, please, Ahmed?
Do you hear me now?
Yes, now it's okay.
Yeah, very good. Thank you very much, Tarek.